Hey there, this is Christina, and this video is part of my college graduation series. I'm making it in May of 2014, and I graduated from George Mason University in May of 1994. So I've been out of college for 20 years. I can't even believe it. I mean, I just can't even believe it. I don't even feel this old. I just can't even believe it. But so since this month is very significant to me, it's an anniversary, I have gone through my attic and my basement and my boxes and my scrapbooks, and I found some things from college, my college days, some pictures and transcripts and certificates and stuff that I wanted to take out of the scrapbook that are just kind of hidden there, sitting there, and digitize it and make some photos and videos and just share part of my life, like who I was back then. And not that it is relevant anymore, but it's kind of nice to go down memory lane and think about where I started, where I came from, the choices that I made, and my personal growth and development. So on graduation day, on commencement, during commencement, I was inducted into these 3 honor societies. And the first one was the PreMed Honor Society. Get the camera here. I was pre-med in school. Gosh, there's so much to say about this. I thought that I wanted to go to medical school, and I was putting myself through school, and on the advice, or per the advice of a guidance counselor, of a career counselor, whatever they call them, she said, you know, you're doing very well academically, you have an interest in the sciences, in human biology. I was taking microbiology, immunology, neuropsychology, genetics, molecular cell biology, all sorts of things, exercise physiology, all these different things. And she says, you know, you have an interest in it, and you're doing well, you have an aptitude for it. She says, so now you want to take a job, or even volunteer work in the field, immerse yourself in there, and see if it's what you really want to do day to day. So I did do that. I put myself through school, and all my jobs were in the healthcare field. I worked at a lab, I worked at a primary care practice, I worked for George Washington University Medical Center, I worked for did I say Quest Diagnostics and Roche Biomedical? And through these jobs, I learned that I didn't want to be a doctor who practiced medicine because of a couple different reasons. One is how much control the insurance companies have over what you do. There's utilization and review boards that really influence the care that you give patients, kind of actually control it. And you know, there's not a lot. You don't have a lot of latitude if you want to get reimbursed. I don't want to get into all that, but I didn't like not having autonomy as a physician to do what I want. And the insurance companies really control it because they determine if they reimburse you, and people have health insurance. They're not self-pay, so you have to play that game, and I wasn't willing to play that game. Also, working at the family practice, there's always drug reps coming in and out of the place, leaving samples, and everything was all about the prescription pad. And even way back then, I was in school. Started my pre-med studies in 1986. So even way back then, that didn't feel right to me. I cared more about eating healthy, working out, and preventative medicine. In fact, what I was really interested in, as far as the subspecialty of medicine, was cardiology. And I wanted to be a cardiac surgeon if I had actually gone through with all this. But at some point, I thought, and I'm speaking like who I was back then, I thought, you know what, I think I could be more influential on the proactive side. Like, I don't want to treat people after they have a heart attack, you know, with, or they have angina, I don't want to be giving nitroglycerin and defibrillation and streptokinase and coronary artery bypass graft surgery and balloon angioplasty and all these different things. And I worked in a lab. I worked for a lab where I was working for Dr. Lafrac at Fairfax Hospital, Edward A. Lafrac, and he was a cardiac surgeon, and he did heart transplants at Fairfax Hospital. And what he sent into the lab was heart tissue, and it was stat. We processed that immediately because we needed to see if that transplant patient was accepting and assimilating the new tissue that was grafted. This is heart tissue. This is responsible for every heartbeat every day of your life. I mean, every minute of every day of your life. It's so important. So this surgery is, incredibly important. So when we would get the tissue, like everything else stopped, and we would process that tissue for him because we wanted to make sure that that patient was not mounting an immune response to that tissue and was accepting it and would be doing well with their new heart. So that was a very important job that I had. I also volunteered at Fairfax Hospital and observed some surgeries. Would get, gowned up and wash our hands with the aseptic. Hospitals have an infection control plan to prevent against nosocomial infections, and would just get all gowned up and would observe surgeries. So, and this was like, this was like between 1986 and 1994. But anyway, I decided that I didn't want to work with sick people, that I really wanted to be more on the proactive side and prevent things. I mean, there's definitely, so much respect for doctors who are there when people need treatment, and we know that people aren't going to most people are not going to do what they need to do as far as healthy habits for a number of reasons. It's very complex, socially, economically, emotionally. There's so many things that have to do with food and beverage and alcohol and drugs and smoking and toxins in the environment. I mean, it's beyond the scope of this video, but so we will always have a need for treatment. But I just thought that I could be more influential, or where I wanted to be influential was on the front end. And I thought, even being a personal trainer, I said that or a nutritionist, that could be something to help people not even end up with a cardiac surgeon. So I got really into learning about working out and learning about optimal nutrition and stuff like that. So anyway, all of this to say that I did not take my MCATs, even though I got A's in like biochemistry and organic chemistry and all these classes that I mentioned earlier. I didn't take the MCATs, and I didn't go to Medical College of Virginia, which was one of the places I had visited, and I decided to just complete my my degree in psychology, which I was taking a lot of psychology classes at the time because I wanted to understand people that way, not just the human biology, but the psyche. So I ended up graduating with a psychology degree with a minor in human biology since I was pre-med. But because I got, A's and B's in all my PreMed classes, on my science classes, I was awarded or inducted into Alpha Epsilon Delta, which is the Pre-Medical Honor Society. So I was really happy about that at the time. And speaking of psychology, so I was taking all the psychology classes, and I did very well in them too. So I was also inducted into the National Honor Society in Psychology. And this was in March. Well, yeah, it was in March 1994. Some of these things, they came out just a little bit before graduation. They let you know about it, and they sent you the certificate, and then the actual event where you got inducted was a month or two later. So I've been studying psychology since 1986, and I learned a lot in school from my professors and academically, but I will say that I have been committed to constant and never-ending learning all of my life. My education did not stop when I graduated, and I think, well, I know I've learned much more in the real world post-graduation than I have in school, interacting with all types of people in all different situations, as far as their personalities and their inclinations and their addictions and desires and consumer behavior and just all different kind of things. Psychology covers a wide scope of things, and so that was that. And I still study people today. I'm a student of marketing right now. I am a product creation consultant and a digital marketing strategist, and I study people's online behavior and consumer preferences, brand sentiment, brand enthusiasm, brand loyalty, stuff like that. What makes people buy? What makes people click? Literally, I mean like the mouse, like the buttons, things that, how responsive they are to different marketing messages and offers and images and stuff online. So that's kind of what it morphed into. And there was one more, and this was Golden Key National Honor Society. Now this was more of a general one that just kind of, I can't even remember, I think it was just based on your GPA or something like that. I can't remember. But anyway, I think I said in a previous video, and I will underscore here, that, these things, at the time, and I'm trying to remember so much, I'm really trying to remember who I was back then. I didn't know any better I didn't know anything about entrepreneurial things. There was no internet, there was no social media, there was no Facebook, Twitter, YouTube, there was no podcast, there was no iTunes, there was no mobile devices, no iPhones, iPads, any of this. I've watched all this stuff evolve. So I wasn't exposed to the perspectives of others except for in books, and I read all the time. I was always in Borders. I have hundreds and hundreds of books on my bookshelf, and they're always about success and psychology and stuff like that, but not so much entrepreneurial. I didn't really understand that. I wish so much that I knew back then what I know now, because in an academic environment, somebody else is setting the success criteria, not you. And you fall into that, and, you adjust to your environment, and then you just, this is how they calibrate you, or how they approximate your value. And of course you want to be the best that you can, and you do these kind of things. So although I'm proud of my certificates and my honor societies, I just want to let you know what really matters in the world are the results that you create for others. Thank you so much for watching my video, and I'll see you on the next one.